Thank you very much. Thank you very much, Your Excellency. Your Excellency, the Vice President, honorable ministers, members of the media, ladies and gentlemen. The presence of COVID-19 is being felt in all parts of our country. COVID-19 is not only causing illnesses, it is claiming precious lives of our citizens. As stated by His Excellency, the number of COVID-19 cases in our country has increased exponentially in recent weeks, with cases reported from all over the corners of Namibia. It is a fact that the virus does not move or spread by itself. It is moved and spread by people. It spreads when, in the absence of complying with the precautions, an infected person moves from one place to another and gets into contact with other persons and infect them. These infected persons, failing to observe precautions, then go on and infect others, and the chain grows longer and longer. In order to arrest the spread being observed in recent weeks, the current COVID-19 state of emergency regulations will be adjusted as announced by His Excellency. I now proceed to outline the details of the newly approved measures as part of our national strategy to combat COVID-19 in our country. The measures as approved by Cabinet are as follows. 1. All 14 regions of the country will revert to or remain on stage 3 level of restrictions under the COVID-19 state of emergency for a period of 16 days from midnight Wednesday, the 12th of August 2020 until midnight 28th of August 2020. This countrywide migration to stage 3 shall take into account all additional measures approved by Cabinet subsequent to the provisions in Proclamation number 21 of the 1st of June 2020, which brought into being stage 3 regulations. The additional measures as later approved by Cabinet shall also apply. The measures currently applicable to the local authority areas of Walvis Bay, Swakopmund, and Arandes are now applicable to the City of Windhoek local authority area, including Okahanja and Rehoboth local authority areas for a period of 16 days. Travel into and out of these restricted local authority areas to the rest of the country will be restricted to emergency situations only, as defined in the regulations. Any person leaving the restricted area, apart from critical and essential service providers, will be quarantined at own cost upon arrival at destination. Drivers of vehicles delivering critical and essential services traveling from the restricted area will be quarantined as per the existing applicable modalities. Although travel will be permitted within the country, with the exception of the restricted local authority areas, the public is cautioned against unnecessary travels. In order to decongest densely populated informal settlements, the Ministry of Urban and Rural Development shall identify facilities and venues where residents can be temporarily relocated. Local authorities shall ensure availability of water and ablution facilities at these temporary relocation centers. Trading hours for the sale of alcohol are 12 to 18 hours Monday to Friday, and from 9 to 13 on Saturdays, No sale of alcohol is permitted on Sundays and public holidays. No movement of persons will be permitted in the restricted areas between 20 hours to 05 hours daily during the specified period, unless such person is in possession of an authorizing permit as an essential service provider. To enforce this regulation, checkpoints will be introduced at specified locations within the city of Windhoek and on the perimeters of the restricted areas to control movement. Face-to-face classes for grade 10, 11, and 12 scholars will continue. Where applicable, learners should stay in the hostels to limit exposure, provided there is no risk of infection at the school. Tertiary education institutions, that is, vocational education training providers, colleges, and university, to revert to online teaching and learning for the bulk of their student population groups that allow adherence to the set health protocols. Early childhood development centers, pre-primary and primary grades 0 to grade 9 remain closed and are to continue teaching via alternative modes of instruction. Across the country, public gathering will be limited to 10 persons, including weddings, funerals, and religious gatherings. The issuance of permits for travel from and to restricted areas to attend social events, such as weddings and church events, is strictly prohibited. However, permits will be issued for travel to attend funerals of immediate family members, that is, a spouse, a parent, sibling, and children. All persons traveling from high-risk areas, including the restricted areas, will be required to submit a mandatory supervised quarantine, for a period of 7 days upon arrival at their respective destinations. Restaurants in the restricted areas shall operate under Stage 2 regulations, that is, on a takeaway basis only. Restaurants in other parts of the country may operate under Stage 3 regulations. It should be noted, as per Stage 3 regulation, that nightclubs, gambling houses, and casinos are not permitted to operate. Employers should encourage employees and people who meet the criteria of vulnerable persons to work from home as far as possible. Expanded targeted testing will be conducted in the City of Windhoek local authority areas and further to other selected areas depending on epidemiological trends. The Ministerial Coordinating Committee will convene as a matter of urgency to consider the implementation modalities for the recently approved Tourism Revival Initiative and operating modalities for restaurants, which recommendations will be tabled for Cabinet's consideration. All points of entry and cross-border movement of persons remain closed, with the exception of the transportation of imported goods. We are now at a critical stage. The public must strictly adhere to the regulations and health and hygiene protocols, which are our first-line defense. The law enforcement agencies must enforce these measures. Members of the public must wear a mask at all times in public places, must maintain social distancing, must avoid crowded public gatherings, and must avoid unnecessary travel to and from different parts of the country. The Ministry of Health and Social Services and the Ministry of Education will intensify the dissemination of public service messages to educate the public about the dangers of COVID-19 and how our people can prevent its further spread. We are standing at a critical point. What we do now will determine the trajectory of this pandemic in our country. To prevent further spread of the virus demands utmost discipline in all our action, whether at home, whether at work, or in public space. I thank you.